These are just some tips for effective communication during your GRASP huddles. The GRASP mentor is going to be modeling bi-directional conversations between advocates and scientists. This is going to include tactful interruptions or redirections. They'll be encouraging the advocate to ask questions, and they'll be ensuring the scientists answer those questions. They'll also intervene if discussions become overly technical. The GRASP scientists should make every effort to enrich the participants' experience by leading an inclusive dialogue throughout the session. These sessions are extremely informal. It's very normal to take breaks, pauses, allow the participants to absorb and understand all the information, and then ask questions if they need clarification. So you can engage both the mentor and the advocates, and when you ask them questions, it will gain insight. You'll gain insight into their perspectives of how cancer has impacted them. If you're unable to answer a question, just be honest and say, I don't know. It's really not a problem. It's actually humanizes everybody to know that the scientists don't know everything. So it's okay to say, I don't know. And you can always follow up with the group after the session. Patient advocates are encouraged to respectfully interrupt, but we do want you to be mindful of monitoring your airtime. So we don't want you to dominate the discussion. We want to ensure that there's a balanced conversation. These are a few do's and don'ts for the GRASP huddles. The first one's really easy. Do attend. GRASP is unlike a webinar. Your absence really does affect the group dynamics in these small group discussions. So please come to the session. Do join the session 5 to 10 minutes early just to account for any technical difficulties. We do ask that everybody turn their cameras on for the duration of the session. GRASP is really intended to simulate a face-to-face conversation. Also, just have fun. These are very informal discussions. And if you're a patient, you do not need a science background to join this conversation. What's important is what you already bring with you, your firsthand experience of how cancer has touched your life and community. And that's either through your own diagnosis or that of a loved one. We always say that researchers are experts in studying cancer and clinicians are experts in treating cancer, but you are an expert when it comes to navigating life with cancer. We also ask that you do not cancel your registration last minute or the day of the Zoom. As we said before, these are small groups, so it's really important that you do attend. And lastly, please, advocates, do not seek medical advice during the session.